we're going to get started. I have the honor to panel this first or this third panel, or the first panel for today, making everyone welcome. Establishing physical and programmatic accessible shelters. Successful sheltering requires more than being able to physically access the site. It means including accessible cots, hand washing stations, portable restrooms, showers, dietary considerations, personal care services, wraparound services needed to make it programmatically accessible too. And those are just a few of them. I'm actually going to, I'm Sadie Martinez. I'm the Access and Functional Needs Coordinator for the state of Colorado's Office of Emergency Management, as well as the International Association for Emergency Management's Access and Whole Community Inclusion Caucus Chair. I am a middle-aged, I'm going to describe myself, I'm a middle-aged Latina female. I have long black hair with some of these things called wisdom highlights, others call them gray or silver. They tend to be up here a lot, and this year it seemed like I added a few more. I have dark eyes and olive skin. I use the pronouns she, hers, and hers. The program I focus on always talks about how to make everyone feel welcome. We do that in the planning with approach using the Access and Functional Needs Resource Framework. This resource framework suggests there are resources everyone needs in emergencies, regardless of who we are. This means that everyone needs access to resources in order to function during emergencies that need to be inclusive and accessible, accessible access, regardless of who we are in the community. We use this memory tool, CMIST, or CMIST memory tool, that came from us from June Isaacson Kales and Alexandra Enders in their wonderful work following the Katrina disaster. This memory tool we use for the purposes of planning, preparedness, response, and recovery. The CMIS resources is utilized to help people remember and include the 5 functional resources that individuals need to have in emergencies and disasters. These resources are also those that can cost lives and save lives. And we're looking at mostly what we need to use, what resources can save lives and quickly. So we look at that CMIS, and C stands for communication resources, M stands for maintaining health and medical resources, I stands for independence resources, S stands for support services and safety resources, T stands for transportation resources. As we work with the inclusive emergency management, we also need to recognize that there are chronic influencers that need to be considered as we look at the inclusive, accessible, making everyone feel welcome solutions. There's going to be toolkits, resources, best and most promising practices. Well, the one that I just described, that using that CMIS resource memory tool is one of those best and promising practices. It's also shared language across any emergency support function partners, any advocacy partners, any language, any culture. And those, but we also need to look at the influencers that also can get in the way when we're doing our planning with our communities. And we use this in a teacher acronym, TEICHR. Those influencers are trust that get in the way of getting access, economics get in the way of getting access to resources, isolation, whether it's geographically, socially, or culturally, capacity, housing, and racism. These influencers are important in the areas that need to be considered, and also identify who is missing at the planning table, who needs a voice as well, so we could be able to identify the solutions with that plan with approach. When we are able to plan with, we're able to learn what we don't know, because we just don't know. We're not a person with lived experience. And the only way we're going to be able to understand that is by having partners help us find solutions, not just admire the problem, that there is a problem. We're able to come together and have solutions. So with that, I am now going to have us gather today for matrimony to learn from each of our panelists, share experience and identified shortfalls, gaps, and problems with solution focus, and some of the how-to approaches for whole community inclusion before, during, and after disasters and emergencies in establishing physically and programmatically accessible shelters. We hope that you will learn something that you don't know, because either you don't have that lived experience, or you have ever met someone with those, or you're not a person with lived experience, or you're not a support service provider supporting those with lived experience or community members with lived experience. And this will give us an opportunity for growth. We hope that some of the stories shared today will help you in the path that you're going to do with your making a plan, working a plan, and protecting the plan by going and identifying something you're going to start, stop, continue, or change. The work you are doing in whole community inclusion and emergency management and establishing physically and programmatically accessible shelters. We encourage you today to find from the panelists as well as the symposium, and then what you have learned, how you're going to apply it, and how you're going to share it. And as the great words from our FEMA Region 8 Disability Integration Specialist, Mike Houston, how are you going to become the force multiplier in the work that you're doing? So with no further ado, I have the honor to serve as the moderator, and I welcome Denise Everhart. And Denise, as I introduce my panelists, if you'll please turn on your cameras. She is the disaster executive, Division Disaster Executive, Pacific Division of American Red Cross. She has been with American Red Cross since 2013. And then we have Sina Jenkins. She is the Disaster Disability Integration lead for Pennsylvania Department of Human Service. She's been in Pennsylvania Department of Human Services since 2007. Kendall Silicorn. She is Deputy Chief Disaster Branch, California Department of Social Services, and she is within the California Department of Social Services. And she is also the lead for mass care and sheltering in California. And then Ron Williams, the branch manager, logistics management for California Governor's Office of Emergency Services. With that, Ron Williams he's been there for over 13 years, and he has played a key role in declared disaster emergencies in the state of California, ensuring people with access and functional needs are being met during sheltering operations. All right, with that, I am going to be doing a little fireside chat, kind of like what we did yesterday with both Vance's panel and then Anne-Marie's panel. But I would first want to start out with asking each of these partners that are coming to the table. They are coming to the table with subject matter expertise. And so I'm going to ask, starting with Sina, and then I'll go to Denise, Kendall, and then Ron. Can you give me just a brief highlight of what kind of work, a little bit about what kind of work you're doing right now tied to making everyone feel welcome, establishing physically and programmatically accessible shelters. So Sina, let's go to you, and then we'll go to Denise.
Thank you, Sadie. I am honored to be invited to participate on this panel, and thank you for allowing me to focus on welcoming shelters and inclusive shelters as a newer member of emergency management, and also still learning from all of you that have years of experience working in emergency management and providing inclusive spaces and accessible programs and services, as well as sharing your knowledge. It's appreciated. So I joined the functional assessment service team in 2019. So I'm very focused on getting people trained and having them be able to deploy to these shelters and these locations to support people with disabilities and provide a welcoming space. So as part of this, I facilitate a disability integration task force. This task force meets regularly outside of disasters, and this includes all of our disability stakeholders and partners statewide and receives their input. so that we can continue to ensure that we're building upon our program and planning to provide accessible, welcoming, and inclusive shelter. So I focus on bottom-up systems of approach, looking at culture, existing vulnerability data, community histories, because history of a community is very important, as well as how you select a location, the intersectionality of community identities, social systems, ensuring and looking at how we can support racial equity and the needs of those that are underserved in our communities. So looking at how we can apply this and include being person-centered and those access and functional needs, best and promising practices. So I focus on a lot lately on cognitive and developmental disabilities, including mental health and behavioral health. I'm a part of the Pennsylvania Dementia Friendly Advisory Committee for the state. So, building those tools that we can provide to our shelter staff so we can support everyone in the shelter. So thank you.
Okay, Denise Everhart, I'm the Division Disaster Executive for the Red Cross. I have the Pacific Division, which is actually Alaska, Washington, Oregon, Idaho, Montana, California, and all the Pacific Islands. I've been here for 10 years. I am middle-aged with reddish, brownish, grayish hair. I'm wearing blue glasses, and my pronouns are she, her, and hers. The work that I have done, I sit in the division, which is kind of in the middle layer for the American Red Cross. So we're hyper local. We have regions across the country that really focus on those county partnerships and that whole community effort. We have a national headquarters that writes our programs and tools, and kind of my job in the middle is to help bring the input from the field up to national headquarters, help bring national headquarters programs down to the field. What I've learned over the 10 years that I've been doing this for the American Red Cross is the importance of partnerships. The Red Cross does open shelters. If you look at the most recent California flooding in January from the atmospheric rivers, there were a total of 82 shelters open. So if you think about making 82 different shelters physically and programmatically accessible, no one organization could do it alone. So our job is to work with our states, with our counties, with all of the advocacy and involved agencies to make sure that we're getting eyes on those shelters and that somebody is able to go through, and not in a blame fashion, but in a collaborative fashion, point out ways to make the shelters better. And so we've really tried to put a strong focus on that on the scene, making the shelters better. At this point in time, Vance and I work very closely together in California. We work very closely with the FAST teams and the other teams, but we also have to look at the preparedness side. So if people aren't prepared to evacuate, if counties aren't prepared for transportation, if we don't have all those pieces in place, having a shelter that is physically and programmatically accessible doesn't help us if we can't get people there. So we're really trying to do more of a focus on the preparedness side and making sure that we're getting that information out and we're getting partners involved before the disaster in order to ensure that during the disaster, we're able to meet people where they need and provide what they need and make sure that they can get whole community resources while they're in their shelter and while they're transitioning back to recovery. I really like working with the FAST teams. I think Vance and I, through trial and error, have figured out how to make that a cooperative effort. And that would be my advice. Throughout this panel, you're going to hear me say, no blame. We're all in this together. Let's all help each other be better at this because everybody wants to be better at this. And so I'll stop there. I've got some answers to some questions Sadie's going to ask.
Kendall, you are next.
Wonderful, thank you. Hello, my name is Kendall Skillicorn, and I am the Deputy Branch Chief of the Disaster Services Branch with the California Department of Social Services. I'm very grateful to be here today with everyone. In California, we really strive for inclusive sheltering that is open to everyone in the community. And so as co-lead of the Emergency Support Function 6 or Mass Care and Shelter, we take that as a serious responsibility. And as we support our local jurisdictions, with mass care and shelter services, which includes temporary sheltering, feeding, and other services. And we really bring access and functional needs into every facet of sheltering and what we do. So that includes ensuring that AFN considerations are in every plan and across every plan we either develop or provide guidance on. Ensuring that during the response, we do have physically and programmatically accessible shelters from the resources that are from the FAST teams that we We actually run the FAST program in the state of California, where we train both state volunteers and county employees to become members of this team to go out into the shelters. And we have, our team also has regional assignments across California. So we really build those local partnerships and those deeper partnerships so that we know what is the greater need in each community. So that these regional teams can help coordinate resources in the form of personnel or equipment and supplies to support sheltering operations. And as we all know, successful sheltering requires more than just being able to physically access the shelter. It means including the accessible cots, hand washing stations, portable restrooms, showers, dietary considerations, which has become a bigger endeavor here in California, personal care services and wraparound services needed to make it more programmatic accessible. And we keep this in mind in every program that we're in. So I don't want to take up too much time on the intros, as I'm sure we'll get into a lot of these things deeper into this again. Thank you very much for having me.
Good morning. It's a pleasure and honor to be here. My name is Ron Williams with the California Office of Emergency Services, serving in the Disaster Logistics Planning and Coordination Branch. Inclusivity is very important to us, as well as collaboration and partnerships. And one of the first things we do when we're looking at sheltering operations is working with Kendall and Denise is assess each facility for access and functional needs. And it is the first item we address during any emergency or disaster, in which there have been many in the state of California since 2013. And should the shelter be lacking or shelters be lacking any resources, we bring those resources to bear first and foremost to make sure we can support all survivors. And it is about teamwork, it is about relationships, and it is about collaboration, all of us working together, along with Vance Taylor, our chief director here for access and functional needs. We've made great strides in this state. But again, I want to reiterate, we couldn't have made those strides without working with Department of Social Services here in California, as well as the American Red Cross.
Yay. Thank you all for your introductions and letting us know a little bit about what you're doing, how you're being involved in everything in our making everyone feel welcome. With that, I'm actually going to start and asking some of these questions. And so I'm going to go around and I'll start with you, Denise, on answering this. Then I'll go to Kendall, Ron, and Sina. I always do that because I think it gets you prepared to answer that, especially when we're looking at all of the answering these questions all at once. It helps us get prepared. All right. So when thinking about planning for inclusive, accessible sheltering response, how do you recommend people with disabilities and access and functional needs and or their supporters approach inclusive planning before they even get to the shelter?
So, we have developed with other organizations some checklists and some know before you go type of things. The very first thing that we see that is often a challenge is having the caregiver or the family member, whoever's there, as part of your plan. A lot of people plan separately and they don't plan for that caregiver, that long-term caregiver, or if that caregiver needs to go take care of their own family or something else. So really making sure you have a robust plan, mapping out your transportation, and really looking at what that is, but also making sure that there are people in your community who know about your situation and can be of assistance. I tell everybody to have a kit. I tell everybody to be prepared for 3 days, but we all know the realities of disaster response, and this room is filling up. We all know the realities of disaster response and the challenges around being able to leave with your medications, with your equipment. You need to have a full, robust list. You need to check that list. You need to rehearse that list. You need to have a plan and a pack. There are resources out there to help you. And that is the number one thing, is start planning now for a longer term evacuation, and where resources allow, get your pack and your kit and your plan together. If you don't have the resources to do so, now is the time to start working within your community to build those resources, or let people know that you're going to have a lack of resources. More often than not, we see people come to our shelters without a walker, without their medicines, without other things, and it's just they weren't prepared. We really need to start preparing now. The whole community needs to start meeting and making sure that we're getting that information out through every channel to people so that they can prepare.
Denise, I love how you just identified, being able to get a kit before, identify all those all of those resources. That's where I think that CMIST, CMIST resource memory tool comes in wonderfully, because I remember last summer, I got an emergency alert that I needed to evacuate. And when having to need to evacuate, I was like, oh my goodness, I just got a 5-minute warning. What are my most important things I need to take with me to ensure my independence? And I was like, where are my CMIST resources? And so thank you for recognizing that. And that also helps with those who have that chronic influencer in the way, such as economics, don't have enough money to have a 3-day supply of food. So I love how you recognize that, and then being able to force multiply it in all those multiple modes of getting that information out. Awesome. All right, let's go to our next one. Let's go to Kendall. How would you, what do you recommend?
So we take it similar to Denise. Personal preparedness is always very important. And then also when we're working with our own plans and then our local partners, we really encourage that whole community is represented at the table at the planning table. So make sure you are inviting the CBOs, the NGOs, and look at all the partners around you that are going to know the information about the demographics of your population. So it doesn't help to take, a statewide level when you're looking at a smaller community all the time. So you really need to bring those partners that know what your community needs, that knows the different the populations that are included, so that you can make the sheltering a little bit better. So yes, thank you for adding the acronyms. I apologize, in this world of government we live in, we throw out acronyms all the time, so apologies there. But these groups that are the trusted community members and really have the information about the community so that you can properly plan in advance. So you don't know what you don't know until someone informs you of that information. So please, bring the right groups to the table. It'll make it so much easier during the response.
Thank you, Kendall. Ron?
Yeah, it's very important to have a plan. You have to be prepared, as Denise said, and prepare for the long haul. It may not be a 1 or 2 or 3 day thing. It may be long term. So the longer you can prepare for, the better off you will be when you're, if you need to evacuate to a shelter. So with that said, preparedness is key in all of our emergency response and disasters. So that's what I would highly encourage.
Thank you, Ron. A lot of preparedness, a lot of planning. It's before the bad day happens. And again, I'm going to go back to that CMIST memory tool. I just think it's a wonderful memory tool to help me in my preparation a little bit easier. So because of independence, Denise, you were describing even about forgetting my walker. That's my independence resource. It helps me stay independent. So awesome. All right, Sina, off to you.
Thank you. And I wanted to apologize. I forgot to describe myself, so I'm going to do that quick now. So I am 50-something white woman with blonde hair, bob and a bob cut, and blue glasses. So I apologize for missing that. So a lot of great comments to follow up on. Here in Pennsylvania, what I like to do is connect with our Centers for Independent Living and our assistive technology resource centers and providers, such as Temple University. They have a technology for our whole lives. And also ASSERT, which is Autism Services, Education and Resources and Training Collaborative. And they develop a lot of great tools to help persons with disabilities prepare, as well as our Ready PA website. So that preparation is important. There's a lot of tools out there. There's All About Me to be able to provide information written down about yourself, about your needs, about maybe if you have sensory needs or other needs, you can list that in there and be able to provide that at a shelter, as well as checklists and other things that you want to make sure that you pack and prepare for and keep with you. So that information as far as where you maintain all of this important information in your home is just as important as collecting it. And I really liked how one of the panelists stated about if you cannot prepare, and that is also very important. And, you know, having core advisory groups focused on preparedness and planning of those neighborhoods that may be more, have more higher risk to weather events or are more underserved, focusing on supporting those communities and helping them to prepare is also really important. Thank you.
Thank you. I love that. I love all those opportunities or the different ways that you're getting us all ready. All right, I'm going to move on to my next question. Why are partnerships so critical to the improvement of accessibility, equal access, and inclusion of state and local sheltering emergency management programs? Are there any barriers or challenges to that? Or do you have any of them that there are lessons learned? And can you share that with us? And so with that, I'm going to start with you, Kendall, then I'll go to Ron, Sina, and then Denise.
Yeah, so without our partnerships, we definitely wouldn't be able to respond as efficiently or effectively. Each of our partners bring a different perspective, and they're all needed perspectives, and they all work in different areas of either planning, response, recovery. And so we do have strong partnerships with the Red Cross, with Cal OES, with Ron's team, and also with OAFN and Vance's team. So I think it's just, we can't do it alone. It needs to be whole community planning, whole community response, and that goes into who our partners are. So it definitely, and working with the local partners as well. So this is not to be, oh, this is the state. It's also bringing in the local partners and the local community groups who are aware of where to get the resources, who the community populations are that are being impacted most severely or will be needing shelter. So I mean, some of the barriers to that is the more people you bring to the table, the more opinions you have at the table, and the harder it is to include all of those ideas. So that can be a challenge or a barrier. Some of the barriers or challenges can be identifying which groups should be at the table. And, you know, it's just asking around and figuring out who the best representative should be. And lessons learned is, you know, communication and meeting people before the incident happens. So you don't want to meet the first time I work with Denise. I hope it isn't in the State Operations Center. I want to have those early conversations. So we always preach that, we always teach that, and we hope to always practice that as well.
This is Sadie. Thank you, Kendall. I love that identification that the more people you come to the table. To me, I think of that as an alternative format. They all have different opinions and different ways and processes. It's alternative formats. It's a better way to force multiply and get all that information out to our partners. So I love how you identified that. And then when the partners come to the table, ensuring that they have a solution-focused mindset and versus just admiring the problem. A lot of times we're not able to get things done when we're just admiring the problem. We already know there's a problem, especially when there's like-minded partners on the call saying, hey, we identify that our partners or this community is being left out. How can we find a champion or a community connector to be able to help us better understand the how-tos tied to the must-tos of including them in there? So thank you for sharing that. All right, let's go on to Ron, you are next.
Yes, thank you. And I apologize, I didn't describe myself either. Middle-aged male and gray hair, dark hair, blue eyes. I tried to avoid that a little bit. Anyways, as Kendall touched on, and I elaborated on earlier, the partnerships and being prepared and working down at the local level, working with shelter operators, identifying any problems immediately and addressing the problem, not magnifying the problem, but addressing the problem immediately if there is one. We had a situation in which our chief, Vance, went to one of our shelters, and sometimes shelter operators think that the shelter may be access and functional needs compliant when actually it is not. It did not have accessible showers. And unfortunately, Vance learned that firsthand. And what we did was address the problem immediately by providing portable showers. And we didn't magnify the problem, we just addressed the problem immediately for each and every shelter that we utilize.
I love, Ron, this is Sadie again. I love how you talked about identifying the problem. And normally the problem is a resource. You identified that the resource that we needed was an accessible shower, an accessible hand washing station, whatever it may be, where everybody could have access to it. A lot of times it's a universal design resource that everybody can use. So I love hearing how you're talking about what the problem is. It really comes into a resource, and especially because you're in logistics and you're the one that is able to find that CMIST resource, you're able to identify what is the actual resource. We can't just be told, hey, I have a person with a disability that can't use this bathroom. But when somebody says, hey, the actual resource is an accessible restroom, a bathroom, toilet, hand washer, you're able to know exactly what it is. So being able to identify what the actual resource need is versus identifying just what the demographic profiler is. So thank you for sharing that. All right, let's move to Sina, and I think it's Sina and then Denise. Yes.
Thank you. Yeah, and thank you for bringing that up, because a lot of times we'll do a lot of planning and then not consider what the actual resource is on the ground. So making that connection between the two is so important. It's how many volunteers do you have that you think you can deploy, as well as what technology is available to them, and then also considering that built environment. When was the last time a walkthrough was done of that location? And trying to pre-identify issues to troubleshoot them ahead of time if possible. But if not, that on-site walkthrough is so important when you go to a shelter. And again, really taking the time to build the partnerships at the state level can be challenging, because I mean, every community is so unique and has different needs, different resources and capacities available to them. And so the partners at each local level, identifying them community leaders is so important for us at the state level as well as the local level. And building that trust and that relationship takes time. Being able to be inclusive of our own needs, because some of us may have differences in abilities as far as the different approaches that we have to make those partnerships, and really looking to try to support each other as a team. When someone brought up as a team, and like Sadie did today, you know, giving us time to think about the questions so that we can answer it, you know, those different types of little accommodations and supporting each other as a team is so important. So thank you.
Yes, thank you. Thank you, Sina, also for identifying that a lot of times it's about self-care. It's also about invisible disability. A lot of us have lived experience and may not also be diagnosed because we are either under-resourced or underserved as we were growing up. And I could honestly say that I've had a lot of examples in my stories of growing up and not having access to medical health care, not learning to read until 4th grade, not being able to sorry, just got distracted here, not being able to get a lot of my skills addressed with different professional resources. So I had to learn coping resources in order to keep moving forward. And I'm just self-identifying. A lot of people don't self-identify, right? I think about some of our volunteers who may have diabetes that don't identify as a person with a disability, however, need that resource in order to function. And if we're going to go volunteer and there's not a refrigerator for, maybe I do insulin that needs to be refrigerated, or I forgot my medication, how am I going to get that medication? It's not only me as a community member, it's also me as a responder, and how we're all coming together and helping each other and being aware of what are my personal resources that are needed. So yeah, I really appreciate you identifying that self-care, that also those invisible disabilities that may not be others may not know about. So thank you for sharing that. I always learn so much from you, Sina. I love us when we even have conversations on LinkedIn and also in our meetings. So thank you. All right, Denise, off to you.
So I obviously agree with everything everybody said. It's always hardest to go last in one of these question panels. So I'm going to take this a little bit different. One of the things that we have learned over time is to listen to our partners. We are always all constantly learning. And so getting that education and being open to that education, being open to hearing, these are the challenges my clients, my constituents, my whoever are going to face when coming to your shelter. And these are the things you can do better. Really being open to that input and trying to make that part of our solution. We know how to do the logistics, but there are times when we will open a shelter and like Ron said, right? We think, yes, it's accessible. We've gone through our CMIS check-in. That's part of our check-in now, but we miss something, or we don't understand the right ways to make a bathroom accessible to somebody, or we don't know what the right tools are to bring to the table, and having other organizations who can really help us with that and can teach us the right language, the right words to use, how to talk to our clients, what resources are out there that we don't know. We're going through a whole thing around how to deal with people who are on the spectrum. That's something new for us. And what can we do about that? How can we learn and grow and address that population? No one organization knows this. No one organization can do this. There are people who can teach all of us every day. Part of our answer is, part of our organizational motto is get to yes. It doesn't mean that I'm going to do it, right? I always say yes. The answer is always yes. I don't know how, I don't know if I'm going to do it, right? But the answer is yes. And then we come back to people like Ron or other partners, you know, in the community and say, I need to do these things. Can you help? The final thing that I do want to talk about is when we talk about sheltering, we focus very much on the front end, on getting people into the shelters and making sure the shelters are accessible. Getting people back out of the shelters and transitioning to recovery is an area where it's going to take everybody. We have to work on transportation on the back end. We have to make sure that the community is ready to accept the shelter residents back in the community. You can't go back home if your support network isn't there. All of those things are also going to take the whole community, and that's when those county operation centers and those task forces and the state task forces and even the FEMA task forces, that's when those are most important, that we can sit there and casework the folks that are in our shelter and really focus on trying to help them get back to normal. And not everybody who comes to our shelters does have their home destroyed, but if the community support is down, they're in our shelters until the community recovers. And I think that's a piece we miss often, but we should pay a lot of attention to.
Awesome. Thank you. Thank you so much, Denise. I appreciate that. And I love how you identified the seek to understand model, the right way to say something. It's a preferred way of being able to be identified as, right? My preferred way is as a person with versus a label, right? And being able to do that. And we can only learn when we don't know what we don't know, when we seek to understand from those with lived experience. And I love your approach about the yes and approach. Yes, and I don't know how to get there yet, but I am going to get there. So I appreciate you sharing that stuff, that information. All right. With that, I am going to move into our third question here. Throughout your experience, has there been any real good how-to strategies that you would recommend? And with that, I'm going to ask Ron, you the question first, Sina second, Denise, and then Kendall. So any of your how-to strategies that you would recommend that others can duplicate in their state or their local area, that it will be helpful.
Thank you, Sadie. You know, whenever we have an event even start here in California, and realizing we're going to have to evacuate people and open up shelters, we put vendors on notice immediately, which is a best practice we've utilized in the past, because with disasters and emergencies evolving throughout the state, and we have a need for those access and functional need resources, we work with vendors and we'll even secure equipment or things that we need to bring to the fight, because if we don't, we often find that it can be taken up. Resources can be utilized across the United States. I mean, we've requested access and functional needs equipment from as far away as Texas in advance, knowing that we're going to need that for evacuation. So that's a best practice we've implemented here in the state of California.
This is Sadie. I love how you identified, because of lessons learned from past events, you're able to now pre-prepare, because I always think of June Kales when she says they're not lessons learned unless they're continuously applied and tested and done and repeated, right? And so you really are walking that walk on, hey, we learned this, we're going to get prepared, we know something may be coming in. Now that is helpful when we can prepare for the disaster before it happens. It's just when the bad day happens. Now, because of lessons learned, you at least have those partnerships. You could get it as fast as possible. It's just not going to be there instantly. So I love how you're doing that continuous improvement planning there. Awesome. All right. Let's go to Sina.
Thank you. I think also when Denise brought up about those community supports, I think it's very important to pre-identify community centers, especially for those that may speak another language, may like refugee populations, immigrant populations, getting those community leaders involved and connecting with them, having them on, if you have a functional assessment service team, having them as a subject matter expert or that contact that you can reach out to get situational awareness, as well as support on different needs of that community to help you with preparing and also having that trusted messenger. And also another provider that was very helpful, especially during COVID, were our homelessness coalitions. Those providers, they are housing people, sheltering people every day and working with recovery type case management and have access to a lot of those resources. So they're also a good connection to have and to work with when helping people to regain access to services and to recover, especially if there is concerns with them not returning back to their community due to the damage to their home. And also like the departments of economic community development, those agencies too are very good partners to have when trying to start the recovery process.
This is Sadie. Thank you, Sina. And also for identifying that there's champion, there's leaders, there's liaison, there's community connector. One of our counties here in Colorado even have, they call them brokers. They're actually paid to liaison before, during, and after emergencies and disasters. And different communities call it different. It's specific to those communities, and we are in identifying that. So thank you for sharing that information. All right, off to you. I think it's Denise and then Ken.
So I think early on, as we're seeing this increase in disasters that we're seeing just all across the country, resources are getting more and more stretched. So I think an early on identification of gaps. Sometimes we have to do it. Sometimes we have to say we're getting a disability integration person into our disaster relief operation, but it's going to take 3 days. And being open and upfront about identifying any gaps in any coverage and seeing who else you can get to be part of the team to maybe fill in that coordination. At the state level, both in the California flooding and actually in the recent typhoon in Guam, with FEMA and with the territory or the state, depending on where you were, we did break out of the mass care task force a priority populations task force. What we found was the mass care task force meetings ended up being counties reporting out and us talking about shelters and feeding, and there needed to be some extra attention to priority populations so that we could really make sure that everybody was working the problem. And then the final thing that we have done in the Red Cross is we have disability integration. We rely a lot of times on our state FAST teams or other teams out there to help be force multipliers, but we also will put together teams around certain populations that we see. We've done Latino engagement teams. We've done other types of special outreach, knowing when we have a challenge. One other thing that I do want to add into this is looking at your social vulnerability information, talking to your partners and making sure that you're identifying the populations that are most likely missed. When I first started with the Red Cross, we used to miss tribes all the time, we the Red Cross, and we made a concentrated effort to make sure that we had the right connectivity so that we could talk to tribes. We've had to do the same thing in the past few years around homelessness or houselessness, in that is a population that we don't deal with on a regular basis. And we may or may not have the right casework skills to work with that population, but there are those in the community that do. And so it takes a little bit of a lot of groups to respond to a disaster. And so the quicker you can pull that team together in some form of task force, we know the task force model works, and start having those conversations and making sure you're paying attention to the whole community that it's affected and the whole population you're seeing in a shelter. Sadie, you brought it up before. You can look at a shelter and say, these 3 people, one is in a wheelchair, one has a walker, one needs interpretation, right? Those may be obvious things, but there are a lot of things that you can't see. And having people who know how to have the conversations, identify the needs, and identify not just have the conversations and identify the needs, but be part of identifying the paths to solutions. The goal is to make our shelters accessible. That's it. And so what it takes all of us. So you got to build that team that is really focusing on this subject. Vance has been a pioneer in this area. He's worked really closely with CDSS and with the Red Cross, and he's taught us all, you can't ignore us, right? We have to be listened to because we are the voice for the people, and listen to us. We know what we're talking about. Really deliberately doing that on a disaster is the key to success.
Denise, I love, this is Sadie. I love how you were talking about even looking at those who are missing. And a lot of times it is under a social vulnerability index. However, social vulnerability index is a public health and a human service language. It is not emergency management language. So how do we break through in emergency management to better understand what social vulnerability? I've never even heard of this because I'm in emergency management. And I get to learn from my human service and my public health partners. However, I look at resources and how to get them to people in emergency management. Here in Colorado, we're actually looking at moving that into a CMIS resource framework again, and that doesn't matter who we are or what demographic profile, we're able to identify what are the actual CMIS resources needed for, like you identified, our tribal community members as well. And this last year, we've had major success. We've actually done a workshop and a work group with our one of our tribes here in Colorado because of looking at it and being able to have that shared CMIS language. So thank you for identifying that and some how-to strategies on getting there. Kendall, back to you. And I know you're going to talk a lot about your fast.
Yes, I am. So that's one of the things that we have learned and we promote here at CDSS. So calling in the FAST volunteers, so the Functional Assessment Service Team. And I'm going to use the acronym FAST a lot. It's just easier to say. So calling in those FAST programs, the FAST volunteers, as soon as the shelter is set up. Additionally, second prong of that is having local or county FAST programs. Do not rely on the state. There are not enough people. I'm telling you now. We have volunteers, and we're always looking to increase the numbers, but really developing these programs at the local level as well. So in California, all of our shelters are integrated shelters, inclusive shelters, with the goal of sheltering everyone. And so the Functional Assessment Service Team, or FAST program, was started in 2007 and continues to evolve. And it has the purpose of training and deploying people who have a background in working with or caring for people with disabilities and or access to functional needs. And sometimes people don't really understand or self-identify that they have the needs that these volunteers can go in and help link up with resources or see the gap. And so FAST is an extension of disaster health, mental health, and disability integration services. And these volunteers interact with the shelter clients to identify needs and then report back the need, the appropriate unit for the resource fulfillment. And so the FAST volunteers, they go cot by cot in every shelter that they're deployed to, speaking with or communicating with every shelter client. So they really focus on making sure shelter clients can live as independently as possible in the shelters. And so the volunteers are also encouraged, if they have the time, to tour the shelter to help identify or report accessibility obstacles to the shelter manager, shift manager. That's not necessarily what their goal is or their primary mission is there. It's really to focus on the shelter clients. And so the volunteers do use, are encouraged to use the CMIS form, as Sadie has dropped a few times, to assess the shelter clients to uncover specific individual needs. And it helps them identify the possible needs of individual clients, because some things aren't always as obvious. And then once the need has been identified, the FAST volunteer works within the shelter chain of command or organization structure and within the established processes to initiate that resource request. So identifying the gap and working to fulfill getting the resource or the service that is needed for the individual. And so these resources can include durable medical equipment and consumable medical supplies, wheelchairs, canes, AFN cots, glasses, hearing aids, things of that nature. And then FAST volunteers will follow up on the resource request to ensure that the request is fulfilled. So we do daily reports here in California where we send it to a select number to make sure, okay, we've identified 2 people who need, 1 person who needs a wheelchair, 1 person needs a cane. And then we follow up and continue to bug people until we know that that need has been met and that resource has been given to that client. And so they may also identify human resource needs for clients, such as language or ASL interpreters or local services for doctor or medical treatment appointments. And so here at the Disaster Services Branch, we are responsible for training all FAST volunteers in the state of California at both the state and local levels. And so we do FAST certifications. We currently do those virtually, and it's available to the state and county employees. And our state program is activated upon request when the county resources are depleted. And so that's why we're really promoting the county programs or the local programs so that we are a next step in escalation, and we're not just the only team working on this. And so, yeah, we just, we're very big proponents of FAST. We're very big proponents of getting FAST in there at the onset. It's easier to, and it's better for everyone if we kind of identify the gaps early and work to meet the gaps early so that it's not a continued problem that only will escalate. So that's my podium for the day. Is FAST programs are amazing, and I hope everyone has them in their areas.
Kendall, this is Sadie. Thank you. I love how you identified that CMIST. Using that CMIST welcoming packet basically helps people also with dignity and respect, right? They don't have to identify, hey, I'm one of these people or those people, whatever way that it comes across. Well, I'm able to say, I am me people. These are my CMIST resource needs. How can I get access to them? It just gives a lot of dignity and respect without having to feel like I have to identify as a me, right? And feel like I'm an outsider and not included. And I love how that helps everyone feel welcome. I love that. I also love to identify about not waiting until help arrives, right? Being able to keep us all looking at a universal language of a preparedness kit, such as a CMIST preparedness kit, will really help me better identify when I don't have any of those chronic influencers when I do have chronic influencers that get in the way of getting access to my Go kit or whatever it may be. At least I know what I use on a regular basis for my CMIST resources that help me prepare, respond, recover, and get to my next normal. And so I love how you were identifying that and how your FAST teams are really looking at FAST teams are looking at that whole person and that universal design of the CMIST resources. Appreciate that. All right, looking at about 5 minutes left on our panel here. I want to see if there is any out of our panelists, if there's any success stories that has made a change in the process of making everyone feel welcome, such as, do you have any toolkits, resources, best and promising practices that you could share with us? I know, Sina, you have that wonderful toolkit that you want to get shared, and I think we're going to drop that into the chat. The caregiver toolkit, the self-advocate toolkit, and the shelter volunteer toolkit. Are there any other toolkits that any of you can share? So Sina, I'll start with you, and then any of you, the others of you, if you could get your resources ready so we could drop them into the chat.
Yeah, thank you. Just from my experience with working with children, that have autism or another type of sensory need, utilizing the ASSERT, which I had referred to before, which is our Autism Services Education Resources and Training Collaborative, pulling together what they have available and providing it the information to and targeting specific shelter volunteers and what they would need to know, then of course the self-advocate, and then of course the family members and caregivers. And I like how you brought up how, you know, utilizing CMIS allows you to identify the needs without having to know a lot of personal information about someone that they are not willing to share. With regard to a disability, some people are, you know, identify with their disability, and then some people do not. And so I incorporated what they already had created, a safety plan, and asking someone what their safety needs are, you know, with regard to that environment, you know, what concerns are, you know, if maybe having, if there's elopement concerns, and you know, providing extra items and toolkits. I built on our toolkit to provide things like battery operated sensory motion lights. So if someone does get up, the light goes off, and just working with those sensory needs and utilizing the resources that are available to make someone feel welcome and know that there are resources available to support them if there's any need there related to their disability.
Thank you, Sina. Now we are about 2 minutes and I am punctual. I try to be punctual, but however, I will delay for accessibility as we did at the beginning of this symposium. Denise, Ron, or Kendall, are there any other resources we could drop in the chat? If so, will you unmute and with the mindfulness that we only have 2 minutes left?
Yeah, we do have some planning resources. When I was talking in the beginning about preparedness, we do have some planning resources. I will make sure that I drop that link in the chat. I'm trying to do 2 things at once. I'm not very good at that. But we'll get that out. In addition, you know, I think it's important for everybody to know that we're all using the CMIS information. It's part of our new registration app. But it's also that pre-identification. I see a lot of questions in the chat about how we pre-identify shelter locations and the equipment needed. And this all really happens at a county level. Counties more often than not are the ones that do the evacuations, that have the calls, and we're working closely with our counties to identify the best locations for sheltering while making sure that they are fully equipped, ADA compliant, right, and good for the community. And it is a balance, but that's where the resourcing, if we do fall short somewhere, comes into play. My last thing that I'll say is, if you want to help and be part of the solution, we are always looking for volunteers. We have volunteers across the country. redcross.org, volunteer. You can help be part of the solution.
This is Sadie. Thank you. And Kendall, go ahead, and then we're gonna.
Yeah. No, I was just gonna say really quickly, while I don't have something easy and toolkit to drop in the chat, our Disaster Fast program has worked with other smaller communities, other states, to help kick off or update their own FAST program. So if you need any assistance, either starting a program or just wanna confer and collaborate, please reach out to our FAST coordinator. We're always willing and ready to help and learn from your programs as well. So very excited about FAST. And also we recently developed a feeding coalition here in California, so that not only that we have those feeding partners when shelters stand up, but also so that we do have partners that can deliver and support culturally sensitive meals, which is something that
Yay. Kendall, thank you so much. Kendall, Ron, Denise, Sina, thank you all for taking the time out to help us better learn some how-tos tied to the must-tos of helping everyone feel welcome.